Now, today we will be discussing some of the most important image-based questions from pathology, which have been frequently repeated in the last NEET PG, FMGE and INICET examinations. So, our topic of concern today is pathology. And as far as pathology is concerned, let's go through the questions which have been asked. Now, over here, I will be magnifying a slide, and this slide and the question is here. So this is a histopathological slide which represents a cancer of thyroid gland from a young female. It represents a vascular invasion. The type of thyroid cancer known for vascular invasion is. Now, you are well aware of the types of thyroid cancers, and we will just be going through the most important types. I will not go into rarities. You know, papillary carcinoma thyroid, follicular carcinoma thyroid, you know, the medullary carcinoma thyroid, the Hursley cell carcinoma thyroid, the anaplastic, and the lymphomas, which are a bit rarer variants. So there are different pathological features how to differentiate thyroid adenomas and thyroid carcinomas. And thyroid adenoma is differentiated from thyroid carcinoma, especially from follicular. There are two types, follicular adenoma and follicular carcinoma. And one important thing you have to remember that in follicular adenoma, there is no vascular breach of the capsule. So the important thing is that number one, the capsule is not breached, and a characteristic feature of the follicular CA thyroid is vascular invasion. So vascular, the term over here has been just mentioned over here. So you can see in the explanation I have shown capsular and vascular invasion. They are a very important feature of follicular carcinoma thyroid. So over here, this figure is shown. We do not concentrate much on the figure. The figure is there for representational purposes. And as far as the question goes, it tells you about the vascular invasion pathology, which is more common. So you have to remember some of the most important common points among the various thyroid cancers, which is there. Now, there is a question which has been asked. I will just try to magnify. The figure shows a microscopic description of a connective tissue dominated by cells, which are large, vacuolated. So you have to look into the things, the points. The large, vacuolated, smooth cells, which nucleus push to the periphery. So over here, you can have a look at the cells. So you can see there's a large oval cell, and usually over here, you can see that the nucleus has been pushed towards the periphery, and you are having multiple cells in that form wherein the same thing has been shown. Now you have to identify whether what types of cells these are. So the options are the plasma cells, the undifferentiated mesenchymal cells, the fibroblasts, and the fat cells. Now, from the characteristic histopathological diagnosis, you know fat cells are stained by fat dissolving stains, and important is that we have got typical stains. We stain the fat cell like the Sudan stains, and what happens? The nucleus is pushed towards the periphery, giving them giving them the appearance of something which we give the name as signet cells. Signet cells. So the signet cells are a feature of fat cells. So adipose cells are fat cells, are vacuolated, smooth oval cells with nucleus pushed to the periphery. So that is a very important classical histological feature of fat cells. So it is the adipose tissue which is being asked over here. Now we can go and have a look at some of the other things. Now, so as far as the question number 8 is concerned, we just focus on question number 8. The figure demonstrates a plasma cells in plasmacytoma. The true statement about solitary plasmatocytoma of the bone is, so you can see a large concentration of plasma cells over here, and monoclonal plasma cells are seen. Concentrated urine shows M protein is significantly elevated. conversion to myeloma always occurs, and extramedullary plasmacytoma or non-metastasizing. Now that's important. You have to remember some of the pathological features of plasmatocytoma. So important is that plasma cells are seen, but concentrated urine shows M protein is not elevated. So in most of the cases of plasmacytoma, M protein is not significantly elevated. The conversion to myeloma does not occur in all the cases, and extramedullary plasmacytomas are usually metastasizing. So you have to pick up the correct, and the most correct answer is the option A, which is monoclonal plasma cells are seen. So that is very important. So as far as some of the other questions which have been asked in pathology are, now this pathological slide shows Verocay bodies from a 22-year-old male who has a mass lesion. Verocay bodies are as features seen in meningioma, prolectoma, adenoma, and acoustic neuroma. So the correct answer here is the acoustic neuroma or the schwannoma. And schwannomas are usually characterized by being benign, encapsulating, and slow-growing tumors. And you have to remember the pathological feature of the Verocay bodies. So Verocay bodies, you have to remember sometimes the characteristic features asked, and the feature of acoustic neuroma or schwannoma is the classical feature of Verocay bodies. So these are some of the types you have been asked in pathology. I would just like you to go through the image-based section of Platinum Cure Bank IBQ. So that's important, and that will help you a lot in revising for your subjects. Thanks a lot.